emotional. But anyway, I hope y'all are staying safe and healthy.
Good afternoon. I'm Gabrielle Komorowski. North Carolina Governor Roy Cooper is giving an update on the coronavirus in the state. Let's go ahead and listen in.
Deaths today and 259 people in the hospital. We continue to pray for the families of these souls, as well as the people currently sick and recovering from this terrible virus. Even as we acknowledge passing 2,000 cases here, we're entering the first weekend of my order to stay at home. I need you to do just that. I know it's tempting to get away from all this and gather with friends and extended family, especially when Friday means the end of the week. Don't. This virus is still spreading quickly. No one is immune. There is no vaccination, and social distancing is our best protection. Now is not the time for beach trips or neighborhood cookouts. If you must be with other people, please heed the order that bans gathering of more than 10 and recommends staying 6 feet or more away from each other. It could save your life and prevent the spread of the virus to people that you care about. Now, even though we don't yet have medicines to stop the virus, we do have something that can. People. Stopping the spread is in our control. If we avoid mass gatherings, if we wash our hands like never before, if we stay at home as much as we can, if we keep our physical distance, these things work. As we continue our state-level efforts against this coronavirus, we want you to know that we're fighting this battle on many fronts. The first front is the fight for medical supplies and personal protective equipment. This is a bad situation, folks. North Carolina has received 3 shipments from the Strategic National Stockpile. We're grateful for these supplies, but to be clear, we've gotten just 33% of what we've asked for, and they've told us not to expect more anytime soon. Now, of course, we know that we can't rely solely on the national stockpile, and our emergency management teams are working around the clock to find the equipment that is so badly needed by those on the front line of this pandemic. But we're not the only ones. Right now, governments at all levels, hospitals, law enforcement, and others are competing against each other for a scarce amount of personal protective equipment. That means our buyers are placing orders non-stop, but most of them aren't getting filled. There simply isn't enough on the market to go around. I know many of us have experienced this on a personal level. You go online to buy cleaning wipes or disinfectant spray, and it goes into your online cart, but when it comes time to pay, the screen says the order can't be filled and the item is out of stock. The state is dealing with the same problem, but on a massive scale. So if supplies are short, we have to make more. Here in North Carolina, we're encouraging manufacturers across the state to shift their production lines to create the masks, gloves, gowns, and other materials that we so desperately need. Some of those manufacturers are responding positively. And I know the President has ordered some companies to ramp up production of ventilators. This is important and badly needed. But the federal government can and should do more to direct industries to help produce these supplies. This pandemic is a war, and we need the armor to fight it. Another front we're fighting is helping people whose jobs and livelihoods have been lost in the blink of an eye due to this cruel virus. Through executive order, I've made unemployment insurance more widely available. But we know that has also put unprecedented strain on the system. More than 100 times as many claims as usual have been filed. I know that it's been a struggle to file claims and to get questions answered on the phone. I've heard it from people personally. Every claim represents a family on the edge. Every claim is crucial, and I will continue pushing until this is fixed and the process works more smoothly. Lockhart Taylor, Assistant Secretary of Commerce for the Division of Employment Security, briefed you yesterday on efforts to improve and increase capacity for unemployment benefits. I expect them to do this quickly, and he's here today if you have more questions for him. And of course, we're battling on our most important front to keep people healthy and safe. We remain concerned about our congregate living facilities where people are confined and living closely together. Secretary Cohen will discuss that issue in a minute. We're also closely monitoring our hospitals to make sure they have enough beds and people to care for seriously ill patients. And again, this is an area where everyday North Carolinians have the power to help. People ask me a lot, how can I help? What can I do? Well, if you're home, watching this news conference, feeling nervous or powerless, there is something you can do. You can stay at home. You can keep your physical distance. You have the power to slow the spread. Thank you to the North Carolinians who are staying at home. You're protecting yourselves, your families, your neighbors, and our critical workers. You are saving lives. So now here we are. The weekend is coming up. Lots of Tar Heel blue skies are in our forecast. I know it's hard, but stay at home anyway. We are in a crucial time period for flattening the curve, and we still need you to step up. If we all do our part, we'll get through this. On the stage with me today are Department of Health and Human Service Secretary Dr. Mandy Cohen, our Secretary of Department of Public Safety, Eric Hooks, our Director of Emergency Management, Mike Sprayberry, the Assistant Secretary of Commerce for the Division of Employment Security, Lockhart Taylor. Sign language is provided by Nicole Fox and Karen Magoon, and behind the scenes, Spanish language interpretation is provided by Jackie Medivere and Jasmine Medivere. I'll first recognize Secretary Cohen for a few remarks.
Thank you, Governor. I'll start with the rundown of the numbers, some of which the Governor just mentioned. As of this morning, we had 86 counties with cases. That's up from 61 counties just 1 week ago that had cases. And we're up to over 2,000 cases, 2,093 cases, up from only 764 cases 1 week ago. Of these cases, 43% are people ages 25 to 49, 29% are people ages 50 to 64, and 20% are in people older than 65. Today, we currently have 259 people who are hospitalized, and as the Governor mentioned, sadly, we've already had 19 deaths. On the testing front, we've completed nearly 32,000 tests across the state from labs that are reporting, but remember, not all do. And as the Governor shared, this is the first weekend under stay-at-home order. And I need to be honest, we've got to do better with complying with this order. People should only be out to buy food, to pick up medication or get health care, or if they're an essential worker, to go to work. I really need North Carolinians to understand this. We need to be doing everything possible right now to avoid overwhelming our hospitals in the future. Our actions today will impact how this virus spreads across North Carolina in the weeks and months to come. When supplies and medical equipment are scarce, it forces decisions that no one wants to make. As you continue to hear, we are aggressively hunting down supplies, masks and gowns and ventilators from all over the globe. But what I'm seeing in my home state of New York, I never thought was possible in the United States. When too many people get sick at the same time, everyone suffers. There's real harm. And it's not just the people who get COVID-19. It's the person who has a heart attack or an appendicitis or is in a car accident, but there isn't a hospital bed. So we're fortunate in North Carolina to have some of the best and brightest minds working to help us plan so we can hopefully avoid facing any of those devastating choices. We have a team of data scientists from our universities, our private sector, folks from Duke and UNC, Blue Cross Blue Shield of North Carolina, Novasci, RTI. They're working collectively on models for North Carolina. They're looking at our specific circumstances here, like the health of our population, the age of our communities, and the density of our communities. This model will help, but let me remind you that it's not a crystal ball. Modeling is only as good as the data you can feed into it and the assumptions you can make. And this is all so new. We don't have the greatest data to give us the precision we want to know how things are going to play out. But we learn more every day. What we know we need to do is continue to do everything in our power so fewer people get sick at the same time, while also surging the capacity of our healthcare system so that those who need hospital care will have it. But our efforts will only be as good as yours. Please, please stay home and save lives. Thank you.
Thank you, Dr. Cohen. I'll now recognize our Emergency Management Director, Mike Sprayberry. Mike.
Thank you, Governor, and thank you for your leadership. Good afternoon. Today is day 25 of the State Emergency Operations Center activation for the COVID-19 response. 62 counties have activated their local emergency operations centers. 99 counties in the eastern band of the Cherokee Indians have declared states of emergency. We're working hard to plan and prepare for a medical surge, to have facilities ready when hospitals run out of beds. The U.S. Army Corps of Engineers and engineers from the North Carolina National Guard are conducting many facility assessments across the state to find and prepare locations that are suitable for non-congregate housing and for overflow hospital space. At the same time, our mission to find and obtain supplies continues. Personal protective equipment and the strategic national stockpile has been depleted. At this time, we do not have another shipment scheduled from the strategic national stockpile. In total, we've only received about 1/3 of what we requested from the stockpile. The number of basic surgical and face masks we received exceeded our request, and the number of gloves came close to what we asked. But for all other items, we received far less than we requested. Our logistics and sourcing teams continue to find and buy additional protective supplies. Our orders so far have exceeded $100 million, but still, very little of that has been delivered. National Guard trucks and drivers and private transport companies are providing distribution of supplies, and the State Highway Patrol is providing security for those shipments when needed. I want to say a word today about cybersecurity. With so many people working and learning from home right now, the environment is prime for hackers who want to cause cyber disruption. Be sure to be cyber smart. Keep your passwords secure and change them regularly. Make sure your computer is up to date with antivirus software and a current operating system. Be smart about the websites you visit and teleconferencing platforms you use. Don't click on links or attachments in email from people you don't know. These simple steps can help you stay safe, secure, and connected while you stay at home. I want to remind you again that 911 is for emergency calls only. Please refrain from calling to report stay-at-home or social distancing or violations. We need to keep 911 lines open for true emergencies. 211 is taking thousands of calls daily from people who need information or help with resources like food, utilities, child care, and other needs. For twice daily information updates on coronavirus, you don't have to call. Just text COVID-NC to 898-211. You can get text in either English or Spanish. In order to save lives and keep people healthy, we need everybody, everyone, to stay home, stay distanced, and stop the spread. Call your loved ones. Look out for your friends and neighbors, and be kind. Thank you for your support of the State Emergency Response Team. The team is working hard to keep you safe. With your help, we will get through this together as one team, one mission, one family. Thank you, sir.
Thank you, Director Sprayberry, and again, we thank the members of the emergency response team here working 24/7 at the Emergency Operations Center. We're grateful for all of our frontline healthcare workers, our law enforcement, our teachers, people who are working on the front lines, our firefighters, our first responders. We're grateful for all that you do. So now we're going to have questions from the media. If you would please announce your name and your affiliation, we'd appreciate it. First question.
Hi, this is a two-part question on PPE. First, Alabama officials reported yesterday that 5,000 masks they had received from the national stockpile were dry rotted and had expired in 2010. So I first wanted to ask if North Carolina has had any problems with damaged or defective or expired PPE. And the second part of the question was, has North Carolina received any ventilators from the strategic stockpile? And if so, how many were initially requested? Thank you.
Thank you for that question. Not only is it important for us to buy the quantity of the personal protection equipment and supplies that we need, it's important for us to have quality equipment that we receive. I have activated a number of members from the National Guard to help us with the unloading and checking of these supplies and to help us speedily get to the place that we need them to get. I'm going to call on Director Sprayberry, who might be able to answer your question more specifically about our request and what we're seeing on quality out there. Director Sprayberry.
Thank you, Governor, and thank you for the question. We have received 3 shipments from the Strategic National Stockpile, as I have mentioned before. I've not received any report that any of that equipment is dry rotted, so that's something that we can take it under advisement and go back and check. But at this time, nobody's come to me and made that complaint. Regarding ventilators, what we have done is we have ordered ventilators. We expect to have some ventilators coming in next week, but we also have a significant number of ventilators on hand. So that's kind of where we are with the ventilator process. Thank you, sir.
Next question, please.
Next question is from
Yes, please. The next question. From the Daily Reflector.
Hi, this is Bobby from the Daily Reflector. I'm sorry, I actually put my hand up for the last press conference and didn't get answered, so maybe this is left over from that. My question then was really dealing with a large number of crowds that we've had at some big box retailers here, and I wondered if there were reports similar to that in other parts of the state.
We have a lot of people taking this stay-at-home order seriously, but there's still too many people who aren't taking it seriously. We are urging employers, people who have retail stores, to make sure that the people, your customers and your employees, are at an appropriate social distance, and that you limit the number of people in your store if you can't do that. This is critically important, and we want people to think about if they really need to go to the store or not. We're going to be looking over the weekend at more modeling data concerning North Carolina, how much movement is going on, and both employers, employees, and the customers need to realize that these interventions that we put in place can be tightened even more if necessary. We're asking employers in these big box stores to limit the number of people who are in the store, to make sure that people are separated, to make sure their employees are separated as well, so that they do not spread this virus. Thanks.
Hi, Governor, you mentioned that you are encouraging manufacturers to shift the production lines to create gloves, masks, those kinds of personal protective equipment. Are there specific companies here in North Carolina that have agreed to do that? And if so, are you able to tell us about that? My other question is, are there first responders here in North Carolina, and if you have numbers, who have tested positive for the coronavirus?
As to the first question, we have met with manufacturers in North Carolina who have agreed to change their production lines to make personal protective equipment. We don't want to reveal the names of those manufacturers just yet. We want to make sure that North Carolina can participate and receive items that they produce, and as soon as we can make those names public, we will. I have a lot of confidence in the ingenuity of North Carolina manufacturers. North Carolina has been a manufacturing center for decades, and many of them want to step up and to do what's right here, so we're hoping to announce that soon. As to first responders, do we have any information on that? I don't think we have any information on first responders who have tested positive, but we will try to get that information for you. Next question, please.
Governor, I want to go back to the congregate housing issue for a minute, and specifically housing for homeless populations in North Carolina. Some of the charities have had to start moving people out of their traditional shelters and into hotels. Any sort of state or federal aid that might be available in the coming days or weeks to assist with those efforts? Any sort of supplemental housing you might be looking at specifically for those type of operations? And then finally, any advice generally you would have to those type of operations?
Thank you. As you know, I've issued a stay-at-home order. There's some people who don't have a home, and it's more important than ever that we make sure that homeless people have shelter and that we can prevent the spread of the virus there. If people who are homeless are congregating together and the virus begins to spread, then we know we have a very difficult situation on our hands. I just got off the phone today with a number of the mayors of some of our larger cities in North Carolina, and this is a prime topic. Many of them have been working hard on the homeless issue anyway, but has become more acute now because of the threat of this virus. Some cities have already stepped up to provide hotels and other places for our homeless population. We're working to make sure that some of the federal money that is coming down, that's coming to state and local governments in North Carolina, can be used for this purpose. The money states that it has to be used for a COVID-19 purpose, but here you have the threat of the homeless population and the fact that many of them are grouped together. You have the threat of significant infection in this population. So we want to make sure that they are protected. And we're now in talks with the Department of Treasury that's going to be making some decisions regarding what states and local governments can use this federal money for. That would be one of the many COVID-19 related issues we would like to see covered. And I appreciate already the local governments and the nonprofits and the people of faith who are stepping up and trying to help people who do not have a home right now. And it's important for us to provide that help. Thanks. Next question, please.
Hello, Governor Cooper. My question regards local tourism development authorities. I'm curious if you in your executive function have considered waiving some of the restrictions that require those authorities to spend their funds specifically on tourism promotion and address local needs in economies that have been battered by COVID-19.
Those decisions on that kind of tax money that is collected are made by the local governments, but also have to be enacted or changed by the legislature. And I'll tell you, we are in a different time right now. The world is turned upside down for many families in our state, and we're living in a situation that is unprecedented. So I think we're going to have to be very innovative about how we govern and how we responsibly use taxpayer money that people are paying. So I think that all options are on the table here regarding how we're going to best respond to this COVID-19 response, to look at our tax revenue, to understand that because of the hard hit our economy is taking, that probably all of our areas of tax revenue are going to be decreased. So we have to be careful at all times about how tax money is invested, but now particularly we're going to have to make some hard choices. That can just be one of the areas that we can be looking at to make sure that we're investing in things that help us, number one, reduce the spread of this virus, number two, help people who are sick from the virus, and number three, help cushion the blow to the economy that we've experienced because of this. Thanks for that question, and could we have the next one, please?
Hi, we're expecting an announcement from the president at one point today, but he's discussed changing the guidelines when it comes to wearing masks or face protection out in public. Do you suggest that people cover their mouths or noses with something like a scarf when out in public as a way to slow the spread?
The very best way to slow the spread is to not be in gatherings of people and to keep a physical distance. If you do that, then that is the very best thing that you can do to protect yourself. The studies are mixed on wearing a mask. The first thing I would tell you is that we want our frontline healthcare providers and people who are dealing directly with the public to be first in line to get masks and other protective equipment. And as you've heard from this press conference today, that is in short supply. But I know Dr. Cohen and Dr. Tilson, our state health director, have been in conversations with the CDC and others about this, and I'm going to let Dr. Cohen address the issue of masks in public.
Thank you, Governor. I think that's exactly right, with wanting to make sure masks are first prioritized to our healthcare workers, first and foremost. But then as we think about whether masks are appropriate for those of us who are maybe just going out to the grocery stores or the pharmacy, and again, our best way to slow the spread of the virus is to be staying home. But for those who are thinking about wearing masks, I think that can be one component of protecting folks from the spread of the virus. Again, the mask has to be used appropriately, and you want to always be doing the tried and true things of washing your hands. We worry when people wear masks, they think that is a one-size-fits-all for protecting themselves and our community. But the tried and true things that work are washing your hands, wiping down those surfaces, and of course, keeping social distance. Thanks.
Thank you for that question. Next question, please.
Hey, Governor Cooper. I wanted to ask first, how many state employees are working from home versus how many have to still go into the buildings? And also, why North Carolina is not getting the full supply request when other states are getting more? Thanks.
Well, first, our state agencies, all of them have been directed to make sure that any employee that can work and provide telework from home, that they do work from home. And many of our state agencies are doing this and have increased the work at home as we've been able to get devices to people and connect them to work. As for the exact number of people, I would have to get that for you. As for the request that we've received from the Strategic National Stockpile, I don't think any state would tell you that they have everything they need right now. In fact, most states are on the open market, realizing that the federal government just simply doesn't have it to give to them right now. The federal government has given us their version of their priorities, and they're putting their equipment and supplies in the places that are feeling the most acute need right now. But we know in North Carolina from our modeling that that kind of situation is coming toward us. And the thing that we can do to stop it is to stay at home and to do our physical distancing. And hopefully we don't have the kind of surge that New York did, but it is possible that some places in North Carolina could see that very thing. We are fighting for as much supplies and material as we can get. I'll let Director Sprayberry, if you've got anything to add to that.
The governor's on target. I don't think that you'll find a state out there that's going to tell you that they received all of the personal protective equipment that they require in order to stand up an adequate response to the COVID-19 pandemic. Everybody was expecting more from the Strategic National Stockpile. We know that's depleted now. Globally, nationally, statewide, and locally, we're all competing now to try to get those types of medical supplies and resources. So that's where we are. And again, I don't think that you'll find a state that will tell you that they have everything that they need. Thank you.
Thank you for that. Next question, please.
Hi, thank you for taking my question. My name is Kate Martin with Carolina Public Press. This is for Mr. Taylor regarding the applications for unemployment. How long does it take to process the applications given the amount of people who are in line to be processed, and what percentage of those that are already reviewed have actually been approved?
Thank you for the question. Right now, we are advising everyone that has filed a claim with Employment Security through our online system and has identified COVID as the reason for separation, that it do not expect a payment on that until 2 weeks after they file that claim. So far, as of this morning, we have paid a little over 41,000 individuals, a little over $10 million. That represents the number of claims that were filed up through Friday the 20th, I believe it was, following the governor's announcement. We are starting to get these monies out. These monies will continue to go out, and at larger amounts starting next week, as we saw the increase of claims that were being filed the week following. And was there another part to that question I missed?
We want to thank you all for coming. We want to thank you for staying at home this weekend and through the next week. Know that your state government is working around the clock to try to protect North Carolina from this virus, and we need everyone to do their part. Thanks so much.
And you have been listening to an update from North Carolina Governor Roy Cooper and health officials. Officials say there are 2,093 cases of coronavirus in 86 counties in North Carolina. 43% are people ages 25 to 49, 29% are people ages 50 to 64, and 20% are people older than age 65. 259 people are hospitalized in the state right now, and 19 people in the state have died. Now, we are entering the first weekend with the governor's stay-at-home order in effect. The order directs people to stay home unless they have to leave for essentials such as work, food, medicine, outdoor exercise, or to help someone. The governor also says the state has just received 33% of what they've asked for from the national stockpile of personal protective equipment, or PPE, and he says he does not know when the state will receive more. Governor Cooper is urging people to follow his stay-at-home order and says social distancing is the best protection. The governor also says he has issued an executive order to make unemployment insurance more widely available for people in the state. And we will, of course, bring you all of the day's top stories back here on air on WYFF News 4 at 4. You can always look for updates on WYFF4.com and our mobile app as well. We'll send you back now to regular programming.
Reese's eggs are back, and we hit them somewhere you'll never find.